You know, every single step you take, every time you jump or even just stand up, you're relying on this incredible piece of engineering. Today, we're going to dive deep and really get to know the human knee.
So right off the bat, let's just bust a common myth. A lot of people think the knee is just a simple hinge, like on a door. But that idea, it doesn't even come close to telling the whole story. We're talking about a biomechanical marvel that's way more complex and honestly, way more elegant than you might think.
All right, let's get into it. What exactly makes the knee so much more than a simple hinge? We're going to unpack its complexity piece by piece.
Well, for starters, the knee is what's called a synovial joint. So what does that mean? Basically, imagine it has its own built-in oil can. There's a special lining that produces this fluid that not only lubricates everything for silky smooth movement, but also feeds the joint vital nutrients. Pretty cool, right?
Okay, so every great structure has to start with a solid foundation. And for the knee, that foundation is built from three really essential bones that create its core framework.
Up top, we've got the femur. That's your thigh bone. And this isn't just any old bone. We're talking about the longest and the strongest bone in your entire body. It's designed to handle massive forces, and it forms the top half of the knee joint, giving all those powerful leg muscles a place to anchor.
And right below the femur, you have the tibia. You probably know it as your shin bone. It's the second largest bone, and its main job is to bear most of your weight. It creates this kind of flat platform that the rounded ends of the femur can glide on.
And then, of course, we've got the patella, your kneecap. It's not just a bony little shield, though. It's super clever. It acts as a fulcrum, which basically means it gives your muscles extra leverage, making it way easier to straighten your leg. It's like a built-in power booster for your quads.
All right, so we've got the bony framework down. Now it's time to bring in the soft tissue team. I like to call these the unsung heroes of the knee. They're the cushions and stabilizers that hold everything together and make sure it all moves just right. So, think about it. You've got these two huge bones, the femur and the tibia. What's sitting between them to absorb the shock of every single step you take?
The answer is the menisca. You have two of them in each knee, and they're these C-shaped pads made of a tough, rubbery cartilage. They are the perfect shock absorbers, fitting snugly between the bones to spread out the force of impact and protect the bone surfaces from getting worn down.
And the meniscus does more than just absorb shock. As you can see, it also helps with stability and rotation. But here's the kicker, and this is so important. Its blood supply is terrible. Unlike most parts of your body, the inner meniscus just doesn't get much blood flow, and that's exactly why a tear there can be so hard to heal on its own. Next up on the team are the ligaments. The best way to think of these is as the knee's internal guide ropes. They are incredibly strong, flexible bands that connect bone to bone, and their whole job is to provide stability and stop the joint from moving in ways it really shouldn't. Now, deep inside the joint, you have the two cruciate ligaments, the ACL and the PCL. And as you can see here, they work like a perfect team. The ACL stops the shin bone from sliding too far forward, and the PCL stops it from sliding too far backward. But get this, here's a fun fact. The PCL is actually almost twice as strong as the ACL, even though the ACL is the one you hear about getting injured all the time. And you can see right here how they form this X shape, a cross, right in the middle of the joint. That's actually where the name cruciate comes from. It means cross-shaped. And that crossing design is the secret sauce. It's what gives them such amazing control over both that front-to-back movement and any rotation.
And we're not done with ligaments yet. On the sides of the knee, we've got the collateral ligaments. You've got the MCL on the inside and the LCL on the outside. And they act like these sturdy walls that prevent your knee from buckling inwards or outwards.
Okay, so we've built the knee, piece by piece. We have the bones, we have the cushions, we have the stabilizers. Now for the fun part. Let's see how this whole team works together to create movement. First up, we've got flexion. That's just the simple act of bending your knee. When you do this, those side ligaments, the collaterals, relax a bit, allowing for a really deep range of motion, usually up to about 150 degrees.
And the opposite of flexion is, you guessed it, extension. That's just straightening your leg. As you straighten out, the ligaments pull tight, locking the knee into this super stable position. That's absolutely essential for standing and supporting your own body weight.
And now, this is where that whole simple hinge idea completely falls apart. When your knee is bent, your lower leg can actually rotate a little bit, inward and outward. It's a subtle movement, but it's crucial for things like changing direction. And it's only possible because of that ingenious twisting and untwisting of those central cruciate ligaments.
So when you put it all together, the most amazing thing is how all these different components work in perfect harmony. The bones give you the structure, the menisci are the cushions, the ligaments provide the stability, and the cartilage provides that smooth surface for it all to happen. It's really an incredible symphony of parts.
So yeah, the next time you walk or run or jump, just take a second to remember that incredible symphony of parts working together inside your knee. It truly is a masterpiece of biological engineering. And now that you understand just how complex it is, the real question is, what are you going to do to protect it?